So this video is going to be a revision to the inpatient death routine. So a couple changes in workflow since the previous version of this video. So I wanted to highlight a couple of changes that we have discovered or figured out since the last video. So the first thing you want to do is you want to highlight your patient. So my patient in this case is George Q Demo. So I'm going to highlight the patient, and I'm going to go ahead and go to my documentation tab, and I'm going to go ahead and open up my work list. You can do that by clicking directly on documentation. So the very first thing you need to do is you need to make sure that you've completed all of your documentation for the shift on the patient, your assessments, any interventions that have occurred previous to the death, any events leading into the death, and the circumstances of the death itself may need to be documented. So you want to make sure that you've got all of your documentation regards that completed before you actually close out your chart. So the next thing you want to do is you're going to want to add the death intervention. So I'm going to add here, okay, and I'm going to go ahead and write the word death in my search. And if you're not seeing this death assessment, you may need to go to your any word here to pull it up. It should come up, but the word death should bring up your death assessment. So that is what we do want to use. We're going to go ahead and add that intervention to our work list. So here it is right here. This is our death assessment. So again, we're going to select a check mark, and we're going to document in that routine. So so in this particular work list workflow, you're just basically just going to go through the items and put in the data required. So your time of death. So we're going to say that the patient died at 9 o'clock this morning, pronounced by you're going to basically put in, you're going to put in the user for that situation, and then family notified, postmortem rituals, if yes, fine, care of body, we're going to put all that stuff. Disposition of effects, it's a good idea here if your family members were not around and the personal belongings were not dealt with, you can put here, placed in belongings bag and kept at nurse's station, family aware. So that would be an appropriate documentation for that particular situation. The physician should have been notified regardless. You might put here that physician was on scene when the patient actually passed away, whatever it might be. And then so the physician's name. So here I had Dr. Bouchard, I think was the patient's doctor. So we're going to select Dr. Bouchard. And then so doctor was notified today. And then we can say at 09:05 was the time that we actually notified her. Any implantable devices, whatever. So you're just going to go through this routine and fill out all of those details for the death. So you're going to notice here in the previous video, I indicated that you had to add the Trillium Gift for Life intervention. So the Gift for Life information is part of this death intervention. So you only have the one intervention to add to your list. So you're going to want to make sure that you have notified the Trillium Gift for Life program within an hour of the time of death. So you're going to put in your date here today, and then the time. So we're going to say that we called them at 09:20 after the patient passed away. And was the patient ventilated? No. And then all the information, whether they were intubated, would be followed here. The patient was not a made patient. So Gift of Life will have given you a number. So you're going to enter your number here. And then screening outcomes. So if the patient was eligible for donation, you would put that there. A lot of times our patients are not going to be eligible for donation. In our situation, we're going to fill that out. And then if there's a whole body situation, then we're going to go ahead and fill out that information as well. And that's going to be the completion of your death documentation. So once you have done that, you're going to go over here to your discharge button. You can do this from your actual tracker as well, but you go ahead and press on your discharge button. You will need a discharge order, so you're going to click on add new here, and you're going to go ahead and add a therapeutic intervention as an appropriate management of this particular order. Go ahead and click on your routine, and you're going to submit that order. So now you have an order for the death itself. The next step is you're going to come all the way down here to the patient disposition, and you're going to go ahead and click on that box and open up the options, and you're going to select died in facility as your disposition. That will reflexively open up an expired date and time. So this is your time of death. So you're going to go ahead and click in the white box here, and you're going to put in that the patient died today at 0900 hours. And again, reminder that you will have needed to notify Trillium within an hour of that time. Click on OK. This is now the time of death that is going to be utilized on the patient's record from the medical records area and admitting. So this is the time of death here. Now, oftentimes when a patient passes away, there could be quite a bit of time elapsed before the patient actually gets moved out of the unit and into the morgue. So that is going to be what we're going to utilize as our discharge time. So when we actually move the patient from the unit to the morgue, the time at which that happens is where we're going to do that. So we're going to say in this particular case that we're doing that right now because we have completed all our documentation and all of the pieces of our death routine, and we're going to go ahead and send our patient. So now you've got a time of death, and you've got a time that we've actually moved the body out of the unit, and that's going to reflect accurately what happened, what the details of the situation were. And then go ahead and save and close that routine, and your patient will fall off your tracker and will be appropriately discharged as a death patient with an appropriate time of death and correct documentation on the patient. So that is the revision of how we manage a death routine.